Un son qui résonne dans vos tympans. Le son pur de Radio Pure FM.
It's just anxiety. Can we just, can we separate the two? Because I think they both potentially fall into the category of mental health issues. Is there a difference between the feeling of anxious and trauma? Who wants to take that? The definition of trauma.
I'll step back a little bit just in terms of
You want to back a little bit in anxiety?
Yeah.
Okay.
So outside of just self-care, it's important to understand too when it's time to seek help for anxiety. When it becomes very debilitating, like Dr. Chrysostoma was saying, it's important to go and see a professional. When it's start affecting your work, your home life, where you cannot function, where you start to have panic attack, like they were saying, the ladies were saying, it's important to go and see a professional and seek help. Okay, so that's very important to be mindful of.
All right.
And so
I got home safely, and whew, that wasn't good. Called my doctor or my nurse practitioner, right?
Or your physician assistant.
Or the physician assistant, whichever, a healthcare professional.
Yes.
And recall that experience. What may I expect from that clinician? When I think, well, this was so traumatic, would that be a fair assumption?
Well, in terms of trauma, when we're talking about trauma, so it's an intense emotional response to an event that happens that threatens your sense of well-being. So to the extent that it overwhelms your ability to cope emotionally. So may the event be physical in terms of physical abuse, emotional abuse, sexual abuse. It can be natural disaster like a war, earthquake, also gun violence, an election.
An election. Touche.
So the event can happen once, but it can also happen continuously.
I see. How do I recognize it?
I'll take this one.
Well, go right ahead.
So we can categorize post-traumatic stress disorders into 4 different categories. You have the intrusive thoughts.
Mm-hmm.
You have the avoidance of the symptoms.
Mm-hmm.
You have the heightened arousal. And lastly, you have the negative changes in the moods. So with the intrusive thoughts, you are rehashing or having flashback.
Mm-hmm.
Sometimes that causes nightmares. And with avoidance, for example, some people may have gotten into a car accident, like we said earlier, and you don't want to even look at a car, much less drive it.
Mm-hmm.
So each time you hear a wheel squeaking, makes you have bad anxiety or reliving.
Brings it back.
Exactly, reliving the previous traumatic experience that you've had. Some people have negative thoughts, like, is this going to happen again? If it happens again, will I be dying? Am I going to be living much longer? Will this be repeating itself? Or many times you feel like you dying even, like you're not going to live. Or the last part is feeling on edge, being irritable, being irritated.
And in terms of dynamics, could it affect the relationships amongst friends and colleagues and those around us?
Yes, that's what takes place at work, at
At work.
school, around our friends, and many times we wonder, we say, "Oh, that person, I may just stay away from them." But many times it's because they've been through some situations, and it could be like a smell even that brings back
Or
the
cologne.
flashback. Yes, that triggers. And so we want to just be compassionate and be
Compassionate.
able to know that sometimes people may be going through things that we have no knowledge about. What else would you like to add?
Um, well, in terms of that, since you mentioned the workplace, in terms of professional isolation, a lot of times people feel isolated. So, in a sense, in a way, it's a sense of trauma, that microaggression that people experience at work. People can see it as a form of trauma because the continuous experience of that makes them feel isolated from their peers or students in a college setting. So them not feeling connected to their peers could also create that sense of a heightened, because like Dr. Crisosimo was mentioning, um, that that sense of heightened insecurity around others, and then they get isolated from their peers and don't get involved in different activities, and one may assume is because they're not interested, they're not as smart, but no, it's because
So self-isolation, you can be self-isolation at that time. So in other
yes,
words, kind of detached from reality,
yes,
potentially.
yeah,
Doesn't sound good.
no,
So what do I do? Is there a way I can, how do I address that? Because I'm from anxiety, going to airport situations, or having a bad meal, a number of things. Now I'm hearing something that's much more severe because not only I've been affected by potentially losing a flight, now I may be treating my kids a certain ways, my wife, my girlfriend, my sister, my mom, my boss, my colleague. That sounds very. Anybody in the audience? Anybody can. By the way, there will be plenty of time to ask questions. We're probably gonna save it to the end. Um, it sounds like level 10. You got to do something about it because otherwise it's gonna spiral down. What do I do?
Of course, as you can see, trauma embraces so many other can lead to so many other conditions, like you mentioned, panic attack, anxiety, insomnia, depression. So the number one number one treatment for trauma, it's you have to do therapy, and we have different types
So
of
there is
therapy.
no options. If someone, rather, I'm anxious, it's one thing. But one, it's important for me to understand the difference between when I'm just anxious, sweaty palm, I go to the bathroom, wash my hands, a little powder here and there, and then I come out, I'm brand new. Whereas if it's a traumatic experience, now my behavior has been affected, not just in the moment, but over a prolonged period of time, potentially. So therefore, it's not something that I could say, well, I'm just going to take a deep breath. It may not be sufficient. I need to seek therapy. Is that right?
Yes, definitely. Some of the therapy modalities, like we can find in anxiety, like CBT, cognitive behavioral therapy, we can use that also for trauma because when you experience trauma, you also have anxiety. We have other like types of therapy, and it's very important that you get a support group, you get peer group when you're having, because at least they can relate. You can understand yourself better, so you don't feel like I'm crazy because other people experience the same thing. And like I mentioned before, because trauma comes with other condition, so it's very important that you treat those symptoms. So it's not like you can prescribe like antidepressant, anti-anxiety, and sometimes you can just it depends on the severity of the traumatic experience. You may need different type of medication. Some medications you may have to do just prescribe it right away so that person can have a break. You may need something to help you sleep, because when you experience, like Dr. Chrysostom mentioned earlier, when you experience nightmares, you cannot sleep. We have medication that can help you, just calm you down, at least get a good night's sleep, so it doesn't become like domino effect. You cannot sleep, as a result you irritable, you're angry, and people cannot really relate to you
It's not
because
good.
of what's going on. Yes.
And I don't know about you. I hear antidepressant. I mean, what?
Yeah.
And a lot of us don't like taking pills, okay? I mean, a lot of stigma, right? Is it possible that, one, I do seek professional help, he or she recommend antidepressant, but what the heck is that? What is depression? Because we went from anxiety, which could be just an experience going to the airport just to remain consistent. It leads to a traumatic experience. Somebody's cologne ain't right. Oh, I remember that. But it's so significant, or frankly, some physical interactions with someone, right, that it's significant by definition, where it start affecting my relationship, whether it be with a wife, family members, friends and company, and your boss. Now we're talking about our pocketbook, right?
Yes.
So in that case, you gotta seek therapy. But depression? Are you calling me depressed? So now the question is, what the heck is that? What is depression?
Yes, I'll take that one, since I was covering
Please,
some
stay at
type
it.
of treatment that also include antidepressant. Depression, just like anxiety, is a very, very common mental health disorder. It just affects millions of people. Two keys you need to identify on somebody who is depressed.
Mm-hmm.
The first one is you can just observe the mood. That person has a low mood.
So it's a low mood.
Let's say, like, we all can have a bad day, but when it persists, like, let's say more than 2 weeks, at some point it's like, worrisome. And then there is another key, is when that person all of a sudden does not enjoy things, activities that
Like
they used to
dancing?
enjoy. Like that, like dancing, hiking, yes. So those two components, you really have to pay attention. If they last for too long, when I say too long, at least 2 weeks, that's an indication that that person is suffering from depression.
Now you really get my attention. So number one, two things to look out for, right? So we went from anxiety, trauma, and now I'm on a downside. My mood is affected for a long period of time, right? And second, I didn't want to talk to my wife. That's a trigger. Now we really have a problem. Is that correct?
Yes, that, like you mentioned, is affecting your functioning. Like, you have to interact with your wife. You have to go to work.
Right.
You have to, some social, obligations. You have to, attend them. But you find yourself you cannot do it. It's not you don't want to, but you just can't.
Dr. Chrysostom, what else do I need to look out for? Other than my mood, let's say my significant, anybody next to me, they may see, what's wrong with him? We hear that a lot. What's wrong with him? What's wrong with her?
Yes.
Right? And then, of course, you used to go out have dinner, little dancing at Olay. It's not happening no more. What else? What else? A friend, a concerned friend, a loving friend, or family members, or boss. What else he or she should look out for?
Yes. I'm glad that we're having this conversation, especially among our population in the Haitian community and in the
Critical
Black community.
thinking.
Yes, because many times we take those things for granted, and we're thinking, oh, she's just lazy, or she's just, or he,
Tifisa.
or she wants to sleep all the time, or she's always to herself, isolating herself. Come out and play, come on, watch TV. But it's just a disorder, a problem that many people go through with depression. And as we've stated, we know some of the things that can cause depression, but the cause is one thing, but being able to see it, like when somebody is irritable or they start talking bad about their own self. I'm not pretty, I'm ugly, I'm not, they lack self-confidence. They're irritable. Anything you say, they get moody.
Right.
They
And label.
Yes, and having excessive emotional sensitivity, like some people cry for no reason at all,
Mm.
or they sleep too much, or don't sleep at all. Um, some people lose their appetite.
Mm.
Other symptoms are feelings like you don't want to live,
Don't want to live.
don't want to live. Suicidal thoughts is what we call
Suicidal
them.
thoughts. That's suicidal thoughts. So we're looking at three simple things. Well, not simple. Three situations that deal overall with mental health. Anxiety, right? Not that serious, but serious because it's so common. I'm, I'm kind of anxious right now. Second, we're talking about trauma, right? Seek help, right? And how to recognize it. Third, now we're getting into depression. Our job is at risk, divorce, right? Losing friends, kids don't talk to us, the iPad and everything else. I hear things escalating. Would that be a fair statement? What do I do? Antidepressant. What if I don't like pills? A lot of us don't like pills. What are the things that I can do in addition to antidepressant?
Well, therapy is going to be very important. But like I mentioned before, there's a point if you are so unable to function, unfortunately, you might need a little bit of antidepressant just for a little bit. It
For a
doesn't
little
have
bit.
to be forever, just for a little bit, just
To
to be
bridge the
able.
gap.
Mm-hmm. And then therapy, because a lot of it has to do with your thinking and how it affects your mood. And like Madame Pang said earlier, trauma is very related to depression. And oftentimes, what I've noted in clinical practice are people, a lot of those emotions are rooted in childhood, and that often connects to depression. But because of a lot of the stigma and barriers that we have, we never address some of these childhood wounds. So then we grow up with them, and then they present themselves as adults, and we can't get rid of them unless we address them.
Stigma, huh?
Mm-hmm.
I'm assuming all of us here are professional. We fill out work applications, maybe going to a divorce, maybe we're dealing with child support issues. I don't know how many times we fill out a form, that question is asked, right?
Yeah.
Have you ever seen psych? How, if I'm concerned that, first of all, I'm anxious, I gotta answer that question. And somewhere down the line, I gotta say, I did answer it truthfully. I'm really anxious. Am I gonna lie? And if I tell the truth, right, is there consequences to one, potentially lose a job, don't get the job in the first place, or I gotta deal with court issues? What do I do? I mean, that's a huge deal. That's a barrier.
It is a barrier, and
That's a huge barrier.
it's a genuine concern
What
that
do I do?
people have.
What do you recommend? How that stigma, that fear, which can be traumatic. Wait, what else can that person in that situations, what else, how can he or she take the next step to get over that stigma or the fear?
Well, if it's
What
a
would you recommend?
if it's a concern with your life, especially if suicide is a concern, I mean, you have to think about your life. That's
So it's a priority.
primary. Yeah, that's primary because even with licensing boards, like I know in New Jersey, that's one of the questions that they ask you, and I don't know how it is in Georgia, but a lot of professionals they ask you this question: have you seen a mental health professional when you're renewing a lot of licenses? So a lot of professionals have had to think about that. So then they'll come to
Or
see me.
concern dad or mom.
Yes, concerned dad or mom. So
Mhm.
they've come to see me out of pocket so that their insurance carriers don't report anything to their work. So those are genuine concerns and barriers
I see.
for people
I see.
that they have to worry about. I don't know.
Dr. Christensen,
what you
anything you want to
ladies-
add to that?
Yeah, I think focusing on self-care, focusing
Self-care.
on yourself, and also getting support from friends, from family, having an open dialogue,
Open dialogue.
talk about, things that are going through your mind and
Mhm.
things that are going on at the home
Mhm.
or at the workplace. Finding a confidant. I
A
always, I always encourage people to
Journal.
journal, and mindfulness.
Mindfulness. Madam Para,
I would
any closing
say-
thoughts?
Yes, I would say as professionals, as providers, we should make it a mandate. So we start seeing mental health like any other medical health condition. I know even we, as providers, we know like some people, they may have insurance and then it's not even covered mental health. I think we need to advocate for that because if you are not healthy mentally, I'm not sure how they can expect you to be, a functional member of the society.
Right.
So that's why sometimes we have, some chaotic situation, but we don't look at the roots.
Right.
Mental health, it's not only among our community. It's almost worldwide. It's just a stigma. As professionals, we have to make ourselves vulnerable. So at least teach by example. If we have something, it's just, I'm not saying you have to go on, get that mic and talk to everybody. But we can just relate, tell people, you're not alone. I am doing that too. I am struggling with that. That way, they can feel more kind of, they can relate better to us. So
Got
to
it.
what we're preaching.
Well, listen, I don't know about you. I got 20 more questions, but I can't be selfish. I suspect the audience may have some questions, and first of all, thank you. Thank you. Any questions?
Just a statement and a question. I as a mother of two, a boy and a girl, strong proponent of therapy. I mean, I don't think trauma necessarily has to be the scent of someone's cologne, but it could be a number of things, which if it is, get therapy, please. But, and I'm not even joking, but I know just from relocating to different states and things like that, my son, just making certain that he's seen a therapist and knows how to speak, because sometimes they don't know how to talk to us, and when they're little, maybe they don't have the vocabulary, but somebody that's trained can help them and being able to state exactly how they're feeling. So moving from Florida to Texas, took my son to therapy, and he was able to share some of his thoughts. And he was only in second grade at the time. And we don't think a move is going to be traumatic, but it's important. And also in helping him as a young man to be able to speak and share his emotions as well. So both of my kids have been in therapy, not necessarily due to some major trauma or anything like that, but the childhood, things, that just happened that we wouldn't necessarily think of as trauma, but maybe traumatic for them. But one point, and I apologize, the young lady with the dark glasses, you made it a point to clarify the difference between a sort of a situational moment of anxiety and clinical anxiety. As somebody who 2 years ago was actually diagnosed with anxiety and depression, which completely caught me off guard, but in seeking therapy, cognitive behavioral therapy, which I always have been in it, but like now it's like, okay, this is lifestyle. I've realized that as an immigrant, which is I'm bringing this specific example because this is probably something that affects plenty of us at this conference, but an immigrant, oldest daughter, Sunday school teacher, expected to get straight A's, 3 degrees, 4 designations, all this stuff later, I've realized that my entire life has been anxiety. Anxiety to make my parents happy, to not feel like a failure. And that's something that I'm sure there's probably like 75 degrees in this room, 75 college degrees in this room, designations, IT, nurses, doctors, et cetera, you know what I mean? And so that it's our life, it's what's expected of us as Haitians and as Haitian women. I'm going to be selfish and point us out. And so I think it's important to not see it as a weakness. Men don't see it as a weakness. Go to therapy, get the support that you need, and I'm a strong proponent of it. And I just wanted to make sure I said that because I really loved the fact that you distinguished the two. There's momentary, oh, I'm anxious, I'm trying, and then there's no, this is my existence. How do I deal with that? And therapy does help because 2 years ago, the amount of things that I have on my plate today, I probably wouldn't have been able to handle it. But now I know how to manage. And I was able to do it without pills. But trust me, if I needed a pill, I would have popped it.
So in other words, therapy is just like a generation.
Yeah. Yes.
Make use of it. Is that
Yes.
right?
I often say that when people have a headache, they have a stomach.
They have finger pain. They have toe pain. They have a little blemish here. They seek help. But then when we feel sad, we feel
Internally.
upset, we feel angry, we have grief, we've lost a loved one, we've lost our jobs, we're going through a divorce, whatever it is, that's a traumatic situation, experience. And so if the entire body can need help, the brain is what controls all of it. So if you're taking something for your heart, something for your bladder, something for your kidney, something for your sexual drive, you can take something for the mind because that's the most important thing.
I think
Uh,
someone
wha-
back here had a question. Someone.
Can I
Okay.
can
I'm
I
sorry,
say
Dr.
something?
Doville. Yeah, please go right ahead.
So one thing I wanted to reemphasize on what she said real quick. The whole Haitian community is anxious outside of trauma, just in case. And I don't want to just generalize because we don't have the vocabulary to express it, to identify it, like Dr. Chrysostom and Madame Parent did. But it comes out physically in how we interact and how, professor, 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 everything c'est parfait. It's never fair. Go out, voltiger, voler, you know?
So
It's
education.
parfait, parfait, parfait.
So it's important to educate ourselves about different situations, including mental health, and rather than being reactive, professor, fessa, professor, maybe having a dialogue may be beneficial, or seeking understanding. Is that right, as a parent? So you said not everything should be in fear. Okay.
Because then that creates anxiety, whether you realize it or acknowledge it or not. That fear, it's always there, continuously.
Got it. I think someone had a question.
I'll try to be brief. Hi, good morning or good afternoon. Thank you all so much for paving the way and also contributing your ideas. So my question is towards stigma and access to care because we're talking about all the different generations, the disparities of age and groupings. As a newer generation, we're more familiar with it being first gen or second gen. But when we're dealing with our Haitian parents who either immigrated here years ago, how do we continue to cultivate that space, or what are some experiences that you guys have witnessed within your profession? I don't know if anyone here is MFT, in trying to normalize and continue create a space to normalize the I guess the lingo in terms of mental health and what that looks like and how they can start to implement that into their lives. Like I'm talking about the older generation, like 60s plus, in terms of like, okay, it's okay to also confide in your pastor or result to a church group, but also implementing some mental health strategies in your life to cope with other things as well. So not just relying on one sole factor, but integrating both.
So what are we doing not to leave anyone out? Not it since it affects different generations. What are we doing about it?
I think advocating for mental health is important and not being afraid to speak about it. If there is an experience that we've had, feel free and feel open to discuss it. I've had in my life s- some very close friend of mine that died by suicide. And I talk about it all the time so that people feel comfortable to hear about this. And then there are other symptoms we may have, share it with other people. It's okay to not be feeling okay. So when people know that it's okay to talk about certain things, they're more comfortable listening to it because they've heard it from somebody else.
Bonsoir tout le monde. Moi remercie nous pour présentation nous. Non pas moi c'est Janvier Delors, moi c'est médecin généraliste, l'MT en Haïti mais qu'on y a pas travail sur profession moi. Question moi pour nous c'est que on proche, il est toujours irritable et il pas veut admettre réalité li, like il pas veut admettre qu'il est malade. Ça veut dire il est irritable, il est toujours dépressif et en plus de ça il est toujours like li nauseous, like li toujours senti li mal à l'aise. Qui ça nous t'a conseillé pour nous faire pour proche ça parce que mon toujours dans état que même ou même like li non réalité la vivre pour coller like schizophrène mon a vivre dans propre réalité pâle qui ça nous t'a conseillé il pas veut admettre qu'il malade nous tout connaît professionnellement parlant un monde qui admet li malade tant que traitement fait puis bien tout autant monde n'a pas admettre qu'il malade il pas traité bien. Qui ça nous t'a fait dans cas ça pour monde ça?
That's a wonderful. Thank you so much.
Merci pour question. Li très délicat. Le on moun pas connaît le gon problème, qu'on n'a pas laisser dire ça pour le faire. Donc, especially si moun nan schizophrène j'en dis c'est une maladie qui est plus difficile pour moun traiter parce que moun ça pas en contact avec réalité parce que li nan réalité parle ou pas qu'à essayer faire comprendre que j'en le senti là et pas ça lié. Donc on moun comme ça, il besoin support avec moun la vivre yo. Donc li gen doit c'est s'il croit dans un docteur li habitué avec lui, ou gen doit gen gens doit approcher, li gen doit dire OK, ou gen doit pas ka dormir assez, mon médicament m'a ba ou ka aider dormir parce que vraiment les moun nan yon médicament ça l'aider le dormir. Ou essayer approcher en même temps ou été traité là avec problème li gen mais ou expliquer ça que li ka comprendre dans niveau parle parce que ou pas besoin d'en discuter avec mon ou pas même besoin de laisser montrer que j'en le penser j'en le senti là et pas ça il pas marcher.
So supportive care as a family member
Yes.
or friend, rather say Tifi c'est à fou,
Oui.
on baga nous tande tout le temps. Ti garçon ça pour occuper. It's important to say well maybe I need to be number one be supportive rather than stigma, label, dismiss, encourage maybe, understanding, and seek help, right? Because schizophrenia, I'm assuming, that's like way beyond not just depression, but we're dealing with swings. Is that right?
Et puis yon ba me devle ajouter tout avant c'est nous mêmes qui plus ou moins avancé nous capable comprendre parents nous yo avec ti moun yo non nan mi-temps côté que nous ka comprendre tous les deux parties au plus bien. Li difficile pour normalement des parents nous qui habitués à culture yo côté que pour yo essayer comprendre ça n'a dit yo. Donc nous obligé parce que n'a chercher résultat. Donc nous pas essayer ou pas jamais comprendre rien c'est pas ça. Essayer comprendre côté yo sorti qui ça fait yo penser comme ça et puis comme ça nous capable chercher un terrain côté que nous capable yo aide
So
j'en
be
capable.
gentle.
Good afternoon, everyone. I'm piggybacking on a couple of the questions that they said because I think they answered it. Because the stigma that we find, especially in our seniors, especially those born in Haiti, coming in here, the first thing they said, Mbabal we can see mbafu. Okay, so that's but how do we encourage them, or without having to trick them or go behind their back to get them to get the help, or to encourage them, just if everything, because they keep the stigma, they keep holding in for so many years those past traumas and bringing it forward to today. They don't know how they suppressed so many years, so many decades of problems, that today in their older years, in their senior years, they're being affected by that, and how it affects them and their children and their children's children, and it becomes a generational curse. I hate to use that word, but that's what the reality of it is. How do we help them approach them to deal with that? And you did touch them gently, but they really need the help, the seeking, or just someone to talk to. And my second question with that, do we have a global listing or something of especially Haitian professionals in that field, that maybe statewide, nationwide? Because another problem we face, they will sooner speak to another Haitian person, but mbabal pala blanc, mbabal pala avec ça, no, and even if they speak English, all of a sudden they don't know how to speak English. Okay. Those are my questions.
So how do we, thank you so much for your question. How do we have a database, a referral point, whereby folks can come to you or other people in the field?
Well, before we talk about the database, how do we, you know, I I used to think like that, but I am very hopeful. I see a lot of adult, older generation.
Amen.
Like,
We're
you
here.
know, both of you are saying, you'll be surprised. But it could be because I do speak Creole, and so maybe that make them feel more comfortable to come and talk to me. But yes, there is the stigma that, okay, m'papalwe yon psychologue parce que m'pa fou. But it's the approach, how you approach the conversation. Tout moun bezon moun pou yo pale avel, ou pa bezon fou pour aller au monde, pour parler au monde. You don't have to be, crazy. So all the people that I see, they're not crazy. It's just that sometimes we have stuff that we have to process. We have to talk through. And so in order to do that, sometimes we cannot do that by ourselves. And yes, the pastor can be helpful, but there's certain things they cannot help you process.
So
So that-
therefore, sorry, the issue is database. I need help. You know, I'm at the point that I've listened to you folks, professionals, carefully. I know what it means, the definition of this, then that, recognize the symptoms. I mean, they don't have a phone. I have my phone. Do I use my phone? What? Do I Google some? Do we have a point of
Like,
reference?
for me,
And if we don't have one, I'm sorry.
I'm in the national, I'm for APA and all of these stuff. And also I'm listed like for New Jersey, but outside of the national organization for
Should we have
Haitians,
one?
I don't know. I think we should.
To answer her question,
Well, we have the Haitian American Nurses Association of Georgia.
Hannah?
We have 11, yes, we have 11 chapters. That's one way we can reach out. In our organization, we have Madam President here. We have several members in the audience. One of the things we're doing with Monsieur Joseph, who's sitting right here, he teaches ABA therapy. And what he does in the community, he's training us how to respond to some of the behavioral symptoms that we see, some of the personality disorders or personality conflicts that we see. He has a class that he trains people how to train people. So sometimes you thinking, I don't have the problem, but if I say, I have a training for you that you can help other people, you get the help through the training, thinking you helping others, but really you learning it. For crisis, there is the 988 number that you can call. I've always asked my patients when they go to places to always ask to speak to somebody that can understand their language, because the Spanish, they always ask for a Spanish interpreter even when they speak Spanish. I mean English. The Koreans do it, the Asians do it. And so I always tell them, when you go to any facility, ask for an interpreter and ask for a Creole Haitian interpreter. So that's another way that people can feel comfortable when they're in situations where they can relate to other people that speak the same language.
Thank you. Good evening. It is the work that the panel is doing is unparalleled and unquestionable. That within our community, there's something called cultural humility. A lot of time we go to, I'm from New York, Muncie, et là qui gagne un peu le juif. When they have a problem, they go to their own people. They go to their own doctors. They go to their own accountant, and so on and so forth. Okay? So for us, giving our culture, les nous malades, when we have mental problem, what do we go to? Nalakai boko. Boko son psychologue lié, mais li pas gon training de psychologie. Okay? Moi faire recherche sur ça. Okay? So, m'bal camper là, semicolon. Hannah organization. I joined that organization to help our people. I moved from New York to be here to help with black people. Specifically, I'm not racist. I might be prejudiced, okay? That I have my own biases, that I want to help my own people. Because I saw my children who born here in New York, and I saw how they struggle, right? Middle class, upper to middle class, middle to upper class family. They had a lot of support, but once my daughter got to high school, she found herself sitting by herself in a lunchroom with like about 400 students in a lunchroom, sitting by herself. And yet this is somebody who's like a gregarious person. She knows how to speak, a socialite. And I said, if this person, my daughter, has so much support at home from me, from her mother, from her uncles, what about those people, single father, single mother homes? They have no support whatsoever. So to counter that, what we are doing to Hannah, that we're teaching people to become behaviorists. Okay? My specialization is in applied behavior analysis. Let me give you context. In the world, there are 60,000 people in the world with the license that I have as a board-certified behavior analyst. So I take that, I combined it with a therapy called acceptance and commitment therapy. This is what the government, the military use to treat PTSD, to treat complex trauma, to treat something called moral injury. People go to war. When they go to war, the little kid who's 3 years old, 5 years old, become the enemy. When the general say, you know what, that's the enemy right there, this person take a grenade and throw it at them. Now they get home, they have to be a husband, they have to be a father, they have to be a friend. And yet these people are programmed to be hyper vigilant. Once they get released out of the military, they don't get deprogrammed. So the program we offered at Hannah is that it is nationally recognized, right? It's called Registered Behavior Technician. I took that and combined it with the best methods of therapy, which is applied behavior analysis, cognitive behavior therapy. Cognition is thinking, and behavior is what you do, okay? So we combine 3 different modalities so that we have the most effective treatment available. So I just came from my own coalition. They had their training, the annual convention yesterday and today. I just came from there to get my CEUs. So what we're doing, there's no organization that's doing what we're doing. So kudos to Hannah. So what we are encouraging for people is to get in touch with Hannah. We provide the training to teach you. We don't do symptom-based therapy. We do something called process-based therapy. We look at the root cause of the problem such that we teach you to become a therapist yourself. So I'm going to put a pause that speak with Hannah.
Thank you. What I'm hearing is that we do have some resources, and we're going to say thank you to Hannah, thank you to you, and thank you to Naahp. Questions? Who's next? For the sake of time, we gonna be a little bit brief.
Okay. My question is, this is probably bigger than you guys and probably bigger than what Hannah can do. This is more for like a national and more US-based question. But as people who struggle with anxiety, depression, all these things that you guys were mentioning, a big thing to do is like validate. So how do we validate the trauma that the Haitian people are going through, and that knowing that, okay, you're supposed to have these things that comes with that? Because if you look at the US and the history of like the Native American, they have the highest suicide rates and they die the fastest by alcoholism, right? So that's due to their trauma. But then there have been things put in place such as them going to university for free to rectify some of the things that they're going through. University for free, housing, benefits, right? And Haitians fall along the same thing with their struggle because it's hard. Living a Haitian life in Haiti is trauma every day. It does not stop. So how do you validate that without like, okay, yes, you can go to therapy. That only works for so long. And Haitian people, they don't have the resources like you're saying. This is more of a systemic issue, and I do feel like they are very strong. A lot of Haitian women, yes, they make it. They're hard. They're like, they'll argue, whatever, but a lot of them will make it to 100 with that voice, like Ted D, right? They're very strong people. But also, holistically, how do we validate that and advocate for national support from the government? Because they have to put things in place as well to make sure that we stop the trauma, stop traumatizing people.
I think we have several organizations that can put their heads together. It starts with us having those discussions and putting policies and putting strategies in place together. We have the Chamber of Commerce. We have the Consulate General. We have Naahp. There are so many organizations and other alliances that we have. I think to speak on a national level is going to take more than the three of us. And it's going to take all of our organizations to sit down with a plan and come up with ways that we can approach Senate, go to legislative, go to Washington to make our case. And also supporting one another. Many times when we have problems, we come to us, but when we're doing good, we go to the other people. So I'm saying this to say that we have a gala in December 14th, the Haitian American Nurses Association. We're going to be giving awards, scholarship awards to nursing and healthcare students. And that is the main purpose for the gala. We ask for your help to support it, because when we come together and everybody can see, oh, these groups of people are really united. When we speak, they listen. And then we need to put our monies in our communities. It's not prejudice, it's not racism, it's just our culture. People tend to go where they feel comfortable. And so the Spanish tend to stay with Spanish. But guess what? Their money stays there too. In the Jewish community, same thing. But for us, many times we'll say, oh, yes, I send them back the prefer mal koton lot moun. let's start supporting each other. Let's bring all organizations together, sit down, have a conversation. These are the topics, these are the problems that we have. How do we, as a people, a community, address them so that they get to the national level where these other communities have the support? And we have plenty of organizations that we can, put together to do that.
Thank
And
you so
if we
much.
have to be the first ones to do it, we'll start it.
Start somewhere. One last question.
But also one quickly, but we have to empower the people in Haiti too, so that they can help themselves. Because yes, we can do stuff here, but people in Haiti, to stop the trauma in Haiti, part of it has to happen in Haiti as well.
I suspect we're probably going to use Naahp and as the vehicle.
Hi, my name is Joanna Jacob. I'm a behavior therapist right now in my community. And the question I have for you is, we talked about the stigmas of, convincing a little bit and being kind to the people that we notice that have, mental health issues that must seek help. But my question is, how can we convince them further? They come to you, they go to the therapist, but what are the steps that, just like a little cheat sheet, what are the steps that you will provide to them to navigate that past trauma to be able to get up and out of that depression now? And also, people are dealing with payment, like it's a cost a lot. You got to pay 100 plus just to talk to someone for 1 hour. People are only going to do that for so long. So that's my question.
And just an FYI, we do have breakout sessions afterwards. So if you don't have your questions answered now, there will be opportunity. They'll be available to you all afterwards. But quick executive decision, we're going to make this one for the last question because there's another group waiting to use the room.
Okay.
Oh, sorry. Can we combine those two?
Salut. Moi, trouve son honneur et pour me capable là. Moi, c'est pasteur Yves Rose Belloni. Moi, senti me content parce que j'ai une belle fille moi dans panel là et moi saluer tout docteur Sayo qui portait toute contribution ça pour communauté. Et surtout jeune garçon ça qui parlé et me senti qu'on touché une question qui est vraiment deep en pile monde capable li. C'est militaire yo psychologiquement yo entraîné pour tirer même si on mouche passe côté yo pas besoin qu'on ait yo vinn pas humain et leur sorti dans ben ça y a bien vivre parmi nous avec un mental que yo pas besoin qu'on ait question que me gain avant que jeune homme ça t'est motivé pour me sentir que faut me parler moi c'est un maman qui a 11 petites ça c'est deuxième garçon moi yeah 11 petites et me gain 20 petites me sentir content mais famille haïtienne a traversé des moments qui sont vraiment deep que personne pas capable lever l'eau ça moi j'ai un garçon mio c'est number 7 numéro 7 lié et petite ça depuis le petit tu pensais que le gon problème tu voulais que moi mettre dans l'école spécialement dit non mathématiques pas rien pour lui c'est garder le bas résultat mais son monde qui toujours pas eh bien lorsque il était gagné 17 ans il commençait à aller à l'hôpital pour problème ça gagné des temps dans voix qu'a parler elle a pas la voix surtout elle a baigné il rit avec elle il parle avec elle il ba réponse avec elle mais elle ne pas parler eh bien petit ça gaspillé d'après moi-même de gaspiller parce que c'est une qui super intelligent mathématiques elle parle dans droite li mais cependant elle pas ca utiliser rien médicaments que au balio vient affecter nerf li la chèque kounya la secoué et puis son monde qui était mes li vient tellement gros mon quoi plus que 300 livres docteur qui n'a pas là question moi qui ça nous capable faire avec un cas comme ça parce que médicaments au pas travail médicaments que vous bali, puisque c'est un problème spirituel que gagne, est-ce que vous doit traiter le problème non seulement au point de vue physique, ou est-ce que vous doit approcher le spirituellement? Parce que, petite moi, depuis à 17 ans, quand il a 31 ans, la prend médicament, au lieu que le fait progrès, c'est qu'on y a la livre prend poids, et puis il a tremblé. Il relève 2 semaines de cela, il n'a pas senti pied encore. C'était question ça.
Thank you. We have 2 questions and appreciate it greatly. Thank you for the question. If we were to address both of them at the same time, is there a spiritual component and more resources?
Moi, capable d'adresser les mains, nous avons l'autre pas en l'autre groupe, qu'il faut nous respecter. Nous